brilliant.
Okay, so we've got Joanne Walker, and you work with the National Health, National Blood Service. So welcome to the show, and thank you so much for taking the time to speak to me today.
Oh, thank you so much for having me on.
Well, you've got such an interesting story to tell us because, well, I'll let you tell us all about yourself and what your role is within the National Health, National Blood Service, and what your job entails and how you got there.
Yeah, okay. So my name's Jo Walker, and I am the Regional Community Engagement Manager for NHS Blood and Transplant. And I cover the whole of the North region, which basically encompasses Manchester. Manchester is a big target area for us, especially because we are looking to target more and more Black heritage donors. We basically came about identifying Manchester by looking at the maps of the country and assessing which areas had the highest numbers of diverse communities, which we've addressed Manchester as. So we do a lot of events out in the community, at universities, at colleges, at schools, but also within businesses and organisations within the city, trying to get as many people as we can to register as blood donors and save as many lives as they can.
Okay, so when we are asked about the National Health Service, what do we think about it? People say, oh, doctors, nurses, waiting times, ambulances, hospitals. One thing they never think about is blood. But the fact of the life of every human being you see in the street has got blood inside of them, so it should be something that is way up there in terms of when you're thinking about the national health. It's just as important about blood as it is to talk about ambulances and waiting lists and so forth. Now, explain why we need blood. I mean, we've all got blood inside us, but not everybody has the same kind of blood. This is where you want to talk about today, the different kinds of blood that different kinds of people need.
Yeah. So basically, we are NHS Blood and Transplant, in case anyone hadn't heard of us, and we are a special health authority. So we work with the NHS, and we basically provide blood and blood products to the NHS. So when we talk about blood products as well, we talk about different aspects that are in your blood. So we talk about plasma, and we also talk about platelets, and both of those are used for different aspects of treatment. So that should that be cancer treatment or burns treatment. But also we provide organs as well as part of an organ donation programme. Basically, blood is needed to help treat many different kinds of patients for many different reasons. Everyone has, on average, about 7 pints of blood. And basically, they're either a blood type of A, B, AB or O, and then they are a rhesus positive or negative of one of those blood types. We actually run an event when we go out in the community called What's Your Blood Type, where we actually register people as a blood donor to book them an appointment to go and donate a pint of blood at one of our donor centres in the city. And basically we're able to offer them the opportunity where we're able to tell them their blood type. It's really engaging and it makes people realise how important their blood group actually is, because it's actually the different types of blood groups are used for many different things. For example, in an emergency situation, someone would receive O negative blood. This is the universal blood type that is actually given to people. It's what's carried in ambulances. It's what's given to people in an emergency situation, may that be childbirth or a road traffic accident, for example, just to kind of make sure the person's okay and help them to recover. What I wanted to come and talk to you guys about today was obviously that we do need more donors from the Black heritage community, because we are seeing an increase in sickle cell and thalassemia conditions, which also require blood. And basically what we'd like to do is encourage more people from the Black heritage communities to come along and donate, because actually to receive ethnically matched blood back actually helps these patients live their life to the fullest.
Because the thing is, it's not saying anybody's any different. I mean, different types of people have different kinds of hair. You know, African hair is different to European and it's different to age. We've all got different, we're all human beings, but we just have different characteristics, you know. And it's not saying anybody's any different. Now, Manchester is one of the most multicultural cities in the world, never mind England. We've got every kind of person, and it's not just a black-white issue. The more mixed we are, now I'll mention something that we just spoke about before we did the interview, T. Margot. Now, if we just talk about T. Margot was a beautiful little child, absolutely gorgeous little girl. And her heritage, people just think, I mean, I'm half black and half white, so I'm mixed, and that's more or less, in this country, probably the main thing. But with an increasingly mixed population, more and more people are being born of 4 or 5 different heritages. Now, Margot, the problem she had when she needed blood, her ethnicity was so mixed. I think she was Syrian, Scottish, New Zealand. She had so many different things. And it's a very sad story, but she needed a stem and she needed certain things. Because she was so mixed and so hard, she ended up, it's very sad, she passed away. She was only about 2 years old. Lovely little girl. And there's also Daniel De Gale, he was a black lad, a young black, I think he was still at school, I think he was about 13 or 14, because African Caribbean people weren't donating. The more people donate, the more likely it is to get a match. There's certain kinds of things that only certain bloods can deal with, and the more people from every ethnicity, not just black, African, Caribbean, every ethnicity, the more chance is that will make a match of people. But what do you think is the barrier? I mean, as a percentage, we can sit here and say, and you know this, and it's not being rude or anything, as a percentage, you would know that certain races give far more or far less than others. Now, whatever reason, the Afro-Caribbean population is very, very reluctant to give blood or get involved in any way, shape or form. Is it something you'd like to, add to that or discuss? Or?
Yeah, well, luckily, I come here today with some good numbers that Black Heritage donors are now giving blood in record numbers, which is great, and more than ever than before, especially since 2017, we've seen a really high increase. But more donations are urgently needed. Like I said, we do need 12,000 new Black Heritage donors this year to meet the rising demand. And what we would ask is for people to look at the local sessions in their area. We are working closely with churches and communities. We now have a community grant scheme as well, where basically we're able to actually work out in the community within all of maybe your listeners' churches, faith groups, community centres, so we can actually raise awareness of conditions such as Teen Margot and people who did really need blood at certain times. But like exactly what you say is, the more people that come along and actually donate, basically we will have more stocks of ethnically matched blood, and then this will basically help the people from the many different mixed communities that we deal with to live a full life. For example, with a sickle cell condition, basically these are patients who need regular transfusions. So every 6 weeks they are receiving about 6 units of blood, which equates to about 6 pints. And they have to be ethnically matched, exactly how you were talking about with Margot and the Daniel De Gale cases. Basically, you have to actually receive the ethnically matched blood to help you live a better life and to actually have a better chance of dealing with the condition and it being better for you.
Now, this is going to sound incredibly stupid, Joanne, but it's a question that I need to ask as somebody doing this show. When the COVID injection was being touted out, I had people say to me, and this is just being honest because I'm trying to do an honest, open interview, I had people say to me they felt it was a conspiracy, that COVID injections were meant to wipe out black people. There is this, I'm not saying it's a big percentage at all, I'm not saying every single black person feels that way, but there's definitely, from what I've spoken to people, a fear of the establishment, a fear of, I think people in the mindset are still going back to the 1950s, the Tusker, when they injected those American servicemen with the syphilis injector, pretended they were helping them and they were actually injecting them with syphilis as a test they were doing. And I mean, that's 1950s deep South America, but there's still, in some communities, in particular old people, there's still this deep-seated fear of authority or allowing the white person to inject them. I know it sounds horrible, I don't mean it to sound like that, but I have had people say that. I'm sure you can reassure people that it's in no way, shape or form anything like that at all.
Yes, I can reassure everyone. Giving blood is safe, it's quick and it's easy. It just takes about 1 hour, and within that 1 hour you save up to 3 people's lives with your one donation. Basically what we'd do, you'd register as a blood donor, where you can register on our website or you can call our number 0300 123 2323, and basically you register, and then we will book you an appointment down at our blood donor centres. We've got 2 in Manchester. We've got Norfolk House right in the city centre off Market Street, and we've got Plymouth Grove as well, up near the hospital and the universities. Basically, everything is clinical, everything is clean and dealt with professionally, as you would find in a doctor's surgery or walk-in centre. We are obviously governed and run by the NHS, so there's absolutely no reason. Obviously, a lot of people come to us with myths and fears, but all the staff there will do everything they can to reassure you. It's just a small needle in the arm that's placed there for between about 4 and 7 minutes, and you donate 1 pint of blood, just following some lifestyle and travel questions that we will check with you before you donate. And we'll also just check that you've actually got enough iron in your blood to donate as well. It's a really, like I say, it's a safe, quick and easy procedure, and we'd look forward to seeing as many of your listeners down there as we can. We do have a website, blood.co.uk. If anyone wanted to go on and look at any questions on there, we've got frequently answered questions, and we do have our call centre who can answer any questions if anyone's got any medical queries as well.
And what I can add to that, I used to give blood until I became iron deficient. But I used to go, do you know when you were based near Piccadilly train station, up that big ramp? Do you remember that place?
Yeah.
And I used to give blood regularly, but as I say, I became iron deficient, so I couldn't take it. Now, I've had lots of injections and I'm still here, so that proves there's no conspiracy to get rid of us dark people. But, so the only thing I can ask, I know at that time there was... For medical reasons, not for racial reasons. If you were if you'd been to certain, because I used to go to Nigeria quite a lot. I remember one time because I'd been there, I had to wait. Is there still sort of restrictions in terms of if you've been to certain countries within the last 6 months or whatever?
Yes. So we do actually have, when you actually come to donate, you will answer a questionnaire that's on like kind of lifestyle choices, be that tattoos and piercings, for example, and travel to any malarial countries. Sometimes there are certain like West Nile viruses and things of different travel to different countries during different times of the year. Some of these can prevent you from donating on the day. So that's maybe why it's a good reason to maybe phone if you have travelled recently when you are registering as a donor or booking your appointment. Have a quick chat with us on the phone about where you've been recently, just to double check. It may only delay you, say 2 or 3 months from actually going to actually donate. So what we would say is just continue to make your date to donate. You can still book one in for 2 to 3 months' time, and then you will still save lives in that time. It'll just be you're making a date to donate at another time. We do all of these checks and all of these questions to make sure that you're safe, that you as the donor are safe to donate blood. And then obviously, as we've discussed, your blood will go to a very poorly person for whatever reason. So we've got to make sure that obviously the blood that they are receiving is safe as well. All the blood that is donated is tested in our laboratories at our sites throughout the country, and that is all tested and tracked before it goes to the hospitals. So we have all these procedures in place, and hopefully everyone would feel okay in actually being able to do that. And all the information is on the website, blood.co.uk, for any travel or health queries that people may have that may think they're preventing them from donating.
Well, all I can say to people, Joanna, if it was your relative who was dying because they needed a pint of blood because somebody can't take an hour out of the day to go and have a quick... And I don't like needles, but it doesn't hurt. None of us like needles. It doesn't hurt. Quick injection, a nice cup of tea and a biscuit afterwards, and that is all you give. It doesn't hurt, but you could be saving someone's life, and you shouldn't need any more incentive than to know you're saving someone's life.
Definitely. I'd want to thank all of your listeners who already do donate and praise their generosity. For those who do actually give blood, it's amazing what you do. It's saving lives every day. And making these record figures possible that we've actually had such an increase, which is amazing in the Black Heritage donors. But I'd urge your other listeners who haven't yet signed up to consider donating blood and look for some more information. And we'll hopefully see you at the Manchester Donor Centre soon.